Welcome to RSSDI TV 2020. I am Dr. Sanjay Kamble, and on behalf of Wockhardt RSSDI TV 2020, I welcome you all. I am glad to have with us today a renowned endocrinologist from Telangana, Dr. Chandrasekhar Valupadas. Sir is the professor of Department of Medicine, MGM Hospital, Kakatia Medical College, Warangal, Telangana. Welcome, Dr. Chandrasekhar, to the show. Sir, based on your recent talk in RSSDI, we would like to know which are the common genitourinary tract infections seen in diabetes patients.
So diabetes mellitus will has more prevalence and incidence of genitourinary tract infections in diabetes when compared with the non-diabetic individuals. So among the common infections, because that UTI, urinary tract infections, urethritis, cystitis, nephritis, pyelonephritis, all these infections are more common in diabetics, but there are certain infections which are almost exclusively seen in diabetic patients. So these infections can be taken as what is called as a indicator disease for the diabetes also. So among them, emphysematous pyelonephritis, emphysematous cystitis, and prostatic abscess, and perinephric abscess, nephrotic renal abscess, and foreigners gangrene, papillary necrosis, and coming to the genital balanopostitis, so vulvovaginitis. So these are the most common infections seen in diabetics than in healthy individuals.
So which are the important pathophysiological factors that attribute to the genitourinary tract infections which are observed in diabetes patients?
So because there is a polyuria in diabetic patients, because the glucose has to be eliminated through the urinary tract only. So this tract is very much rich in glucose, which is a nutrient for the many microorganisms. So the fundamental important risk factor for infections in diabetes is the glycosuria. So these glycosuria not only making the microorganisms grow better, but there is also what is called as they will make microorganisms are eliminated in the urination, mixturation. Because of this adherence, so they cannot be eliminated through the process of mixturation. So they will become in situ in the tissues in the uroepithelium. And third important mechanism for this thing is defective immunity in diabetic patients. Particularly the cell-mediated immunity is defective in diabetes. So their polymorphonucleosides are defective and their killer cells are defective and their complement system is defective. Because of this defective immunity, so they can easily grow, colonize and adhere to the uroepithelium. And whenever their glycemic status is further worsened, so they will take a chance and they will become a very protracted severe infections leading to hospitalizations and leading to much of the morbidity, and sometimes they cause mortality also.
So sir, how can genitourinary tract infections be prevented in diabetes patients?
So very simple to answer this one. First thing is a strict glycemic control of their diabetic status. Because so if their glycemic status is not controlled, so one of the risk factor will be continuing, that is glycosuria. So when glycosuria is continuing, it is a congenial environment for the infections to grow. So to curb the infections, better to control their glycemic status very strictly. And the second thing is what is called symptoms should be recognized very easily. So the burning sensation and because of there is what is called any hesitancy in the mixturation, frequency in the mixturation, and painful mixturation. So these symptoms must be immediately taken to the doctor, because they will test very frequently so that any infection is there in their urine by doing simple urine analysis and sometimes culture and sensitivity of the urine. So the early detection and early prevention goes a long way. So for which patient should bring any sort of symptom, a slightest sort of symptom to the doctor, and the doctor should have a high index of suspicion, and the frequent urinary cultures and examinations will help in early recognition of the infections, so that they will never go into the complicated phase. And third thing is, one doctor has to know about the what are the frequent microorganisms and their resistance and sensitivity pattern in their locality, because choosing the appropriate antibiotics is the cornerstone in the successful treatment of the infections and preventions as well. So for that reason, so they should know about the sensitivity pattern in their locally, because antimicrobial resistance is a most common factor in diabetic patients, so that they are more continuous and protracted in nature. And one more thing is that these SGLT2 inhibitors can cause more glycosuria, so they are more prone for developing the urinary tract infections. So if any patients are using these SGLT2 inhibitors, so those should be stopped in consultation with their treating physician.
Thank you, sir, for sharing your views, and stay tuned to RSSDI TV 2020 for more recent updates from RSSDI. Thank you so much.